Hello and welcome. Today we're diving into a complex congenital heart defect called persistent truncus arteriosus. This condition, present at birth, significantly impacts the heart's structure and function. Join us as we explore its cause effects, diagnosis, and treatment. Persistent truncus arteriosus stems from errors during fetal development, specifically between the 3rd and 8th weeks of gestation. Normally, the truncus arteriosus, a single large vessel exiting the heart, divides to form the aorta and pulmonary artery. In persistent truncus arteriosus, this division fails to occur, resulting in a single, common trunk. The pathophysiology of persistent truncus arteriosus is complex. Instead of two separate vessels, one carries blood to the body, the other to the lungs, there's just one. This single trunk receives blood from both ventricles through a ventricular septal defect, or VSD, a hole between the ventricles. As a result, rich in oxygen, poor blood mix, and too much blood flows to the lungs, straining the heart and lungs. This can lead to pulmonary hypertension and heart failure. Persistent truncus arteriosus is a relatively rare congenital heart defect. It accounts for approximately 1 to 4% of all congenital heart defects. It affects males and females equally, and there is no known geographical predisposition. While the exact cause isn't always known, genetic factors and certain environmental exposures during pregnancy may increase the risk. Infants with persistent truncus arteriosus typically exhibit symptoms early in life. These may include cyanosis, or a bluish tint to the skin, lips, and nails due to the mixing of oxygenated and deoxygenated blood. Other signs include fatigue, rapid breathing, poor feeding, and a heart murmur. These symptoms arise from the heart's struggle to effectively pump blood and the lungs becoming overloaded with blood. Diagnosis usually occurs soon after birth. Doctors often suspect persistent truncus arteriosus based on the physical exam and symptoms. Confirmation involves diagnostic tests, including an echocardiogram, which uses sound waves to create images of the heart. An electrocardiogram, or ECG, monitors the heart's electrical activity. Cardiac catheterization, involving the insertion of a thin tube into a blood vessel, may be necessary to further assess heart and lung pressures. These tests provide crucial information about the heart's structure and function. Persistent truncus arteriosus is often classified according to the Collett and Edwards classification, which describes the origins of the pulmonary arteries. Type I occurs when the main pulmonary artery arises from the truncus arteriosus and then divides into the right and left pulmonary arteries. In type O, the right and left pulmonary arteries arise separately from the posterior aspect of the truncus. And in type II, the right and left pulmonary arteries arise separately from the sides of the truncus. The primary treatment for persistent truncus arteriosus is surgical repair. This typically involves closing the ventricular septal defect, separating the pulmonary arteries from the truncus, and creating a new pulmonary artery using a conduit, or a tube. This new pulmonary artery is connected from the right ventricle to the pulmonary arteries. This redirects the blood flow to function closer to normal. Medications, such as diuretics and digoxin, may be used to manage symptoms before surgery. Unfortunately, there's no definitive way to prevent persistent truncus arteriosus. However, pre-pregnancy counseling can help identify potential risks. Avoiding alcohol and certain medications during pregnancy, along with ensuring adequate folic acid intake, may reduce the risk of congenital heart defects. Genetic screening may also be considered for families with a history of heart defects. The prognosis for individuals with persistent truncus arteriosus has improved significantly with advancements in surgical techniques and medical care. Early diagnosis and surgical intervention offer the best chance for a good outcome. However, long-term follow-up is essential to monitor for potential complications, such as pulmonary hypertension or conduit stenosis. Ongoing research is exploring new approaches to improve surgical outcomes and long-term management of this complex condition.